thyroid gland. Thyroid gland is a butterfly-shaped endocrine gland present at the base of the neck. And it consists of two lobes, right and left, which is connected by isthmus. And its weight is about 25 gram and 5 cm long, 2 cm thick and 3 cm wide. And the height of isthmus is about 1.25 cm. The functional unit of thyroid gland is spherical thyroid follicle, which is lined by thyrocytes. And this thyroid gland is covered by thin fibrous capsule, which consists of two layers, that is inner and outer layer. And this inner layer extrude into the gland and which divide the thyroid tissues into microscopic lobule by forming a septum. And the external layer which continues with pretracheal layer and form fascia. And this fascia later thickens and form Barry's ligament, and which helps the thyroid gland to attach with circoid and thyroid cartilage. And about its location, it located at the base of the neck, that is below the Adam's apple, and lie in front and against of trachea and larynx. And the side of the thyroid gland is occupied with sternocleidomastoid muscle, and above, that is the thyroid gland is present below the thyroid and circoid cartilage. These are about the boundaries and location of thyroid gland. Next we can see the arterial supply of thyroid gland. From where this thyroid gland receives blood supply? Yeah, it receives blood supply from superior thyroid artery, that's branch of external carotid artery, and inferior thyroid artery, a branch of thyrocervical trunk. And about its venous supply. Superior and middle thyroid vein drain the venous blood of thyroid gland to the internal jugular vein. And what about its lymphatic supply? Its lymphatic drainage frequently passes from prelaryngeal lymph node, paratracheal lymph node and pretracheal lymph node. And about its nerve supply. It receives sympathetic innervation from superior, inferior and middle cervical ganglia of sympathetic trunk. It receives parasympathetic innervation from superior laryngeal nerve and recurrent laryngeal nerve. Next we can see the microanatomy of thyroid gland. That is, there are three primary features of thyroid: follicles, follicular cells and parafollicular cells. These are the cells present in the thyroid gland. First one, follicles. Follicles is small spherical grouping of cells and is about 0.02 mm to 0.9 mm in diameter. These follicle cells consist of rim that has a rich blood supply, nerve supply and lymphatic drainage. And these cells plays a major role in production of thyroid hormone. Second one, follicular cells. Its shape varies from flat to cuboid to columnar. It depends on how active they are. And the core of follicle is surrounded by a single layer of follicular. Third one, parafollicular cells or C cells. It is called C cell because it secretes calcitonin. These cells are scattered among follicular cells and the space between the spherical follicles. And how the thyroid gland produces thyroid hormone? The primary function of thyroid is the production of iodine containing thyroid hormone, that is triiodothyronine or T3 and thyroxine or T4. And also it secretes peptide hormone called calcitonin. Thyroid hormones are created from iodine and tyrosine. Thyroglobulin is a protein within the colloid in the follicular lumen and it is created from rough endoplasmic reticulum of follicular cells, and from that it is transported to follicular lumen. Iodine is attached into active tyrosine unit in the thyroglobulin with the help of thyroid peroxidase enzyme. That is, when TSH or thyroid stimulating hormone is produced, it stimulates the follicular cells which is present in the thyroid gland. These follicular cells reabsorb the thyroid globulin which is present in the follicular lumen. Thyroglobulin is a protein which consists of 123 units of tyrosine, and this tyrosine reacts with iodine within the follicular lumen. Iodine is essential for the production of thyroid hormone, and it travels in blood as an iodide which is taken up into the follicular cells by a sodium iodine transporter. That's all about the production of thyroid hormone. Next we can see the regulation of thyroid gland, or how the thyroid gland's hormones are regulated. Hypothalamus secretes thyrotropin releasing hormone or TRH, which stimulates anterior pituitary gland, and this anterior pituitary gland synthesizes and secretes thyroid stimulating hormone, which stimulates this thyroid gland and secrete T3 or triiodothyronine, T4 or thyroxine, and peptide hormone, that is calcitonin. The production of T3, T4 is regulated by TSH, which is released by the anterior pituitary gland. And also the thyroid hormone provides negative feedback to the thyrotropes, and it regulates the production of TSH and TRH, that is thyroid stimulating hormone and thyrotropin releasing hormone. And this calcitonin. Thyroid gland also produces calcitonin, which helps to regulate the blood calcium level. The parafollicular cells produce calcitonin in response to high blood calcium. That is, calcitonin decreases the release of calcium from bone by decreasing the activity of osteoclast. These are about the regulation of thyroid hormones. Next we can see the functions of thyroid gland. The primary function of thyroid gland is to produce the thyroid hormone, that is T3, T4 and calcitonin. And how it affects the human body. Thyroid hormones have a wide range of effect on human body, and this includes metabolic, cardiovascular and developmental. First one, metabolic. Thyroid hormone increases the basal metabolic rate and have an effect on almost all body tissues by increasing their absorption in the gut, generation, and also it helps to increase the uptake of cells and breakdown of glucose. Moreover, it stimulates the breakdown of fats and also increase the number of free fatty acids in the body, and thereby it increases the blood flow and also body temperature. That's why when hormone is increased in the body, that means if T3 or T4 is increased in body, the person may experience high body temperature and also hypertension. Second one, cardiovascular. That means how this thyroid hormone affect the heart. The hormone increases the rate and strength of the heartbeat, and also they increase the rate of breathing, intake and consumption of O2. Moreover, it increases the activity of mitochondria. And third one is developmental. Thyroid hormones are important for the normal development of human body, and it plays a crucial role in brain maturation during fetal development and the first few years of postnatal life. Thyroid hormone also plays a role in maintaining normal sexual function, sleep and also thought pattern. Today we have discussed about thyroid gland, its location, boundaries nerve supply, blood supply and venous supply, and also about its development, clinical significance, and how the hormones are secreted from thyroid gland. Hope you all understand. If you are interested, please subscribe and press the bell icon to get further notification. Thank you.